There goes Bert. It's Friday, everybody. Welcome to DBL. Today, very important day. It is National Wear Red Day, and we are all wearing the color to bring awareness to the #1 killer in America, heart disease. We decided to use today's show to go all in on the topic, so we are dedicating the entire hour to everything heart-related. And it is time for our special heart-to-heart edition of DBL, and our resident doctor and licensed cardiologist, Dr. Pyle Coley, is joining us all hour so we can dive deep on everything you need to know about your heart. Truly life-saving information. So thank you for being here, Dr. Coley. Okay, so we don't want to scare our viewers today. Instead, again, the aim here is to help them notice these warning signs, right? So they can be on top of it.
Today is my absolute favorite day of the year. And it's because it's not just about awareness, it's about empowerment. It's about knowing what to look for, knowing the signs, preventing the risk factors so that we can change the trajectory for our kids and our grandkids and for ourselves.
That's true. We love it. DBL Nation, based on numbers alone, chances are you or someone you know have been affected by heart disease. And the stories are endless. In fact, take a look.
In the U.S., more younger women are having heart attacks than men.
I had the heart attack in the middle of the night. I had the weirdest pains in my wrists and in my elbows, and I had this really, really hard pain in my chest.
Women are also less likely to survive a sudden cardiac arrest than men.
We call a cardiologist, and he's running all the tests. We did the cardiac catheterization the next morning, and I woke up, and he was like, 4 of your arteries are blocked. And so he said, we're going to have to do a quadruple bypass.
Every year, nearly 800,000 Americans have strokes.
I was having bleeding in the brain. So they shaved my head and removed half of my skull so that they can go into the brain and remove the bleeding.
In fact, Black women have the highest risk of stroke.
If it wasn't for my niece wanting to speak to me, the nurses and the doctors were saying, I probably wouldn't have made it.
Powerful stories. And did you know that men and women can have different symptoms of heart issues? In fact, chest pain isn't always a thing, and our next guest knows this all too well. She is a patient of Dr. Coley, and she wants to share her story with the world. So please welcome Sabra Brenner. Yeah. Sabra, thank you.
Where would you like me to look?
Well,
there's so many choices.
Welcome.
Thank you very much.
Yeah, absolutely. We want to know if you can give us some background on when you started experiencing heart health issues.
Okay, well, it's kind of a little bit of a polluted answer here, but 2 years ago, I had what's called a thyroid storm, and my body went upside down, and I ended up with Graves' disease and hives all over my whole body that itched 24/7, which was very ugly.
Wow.
And then a high D-dimer, and let me explain, I'd never heard of D-dimer before I went through this, but what that is I'm be prone to blood clots. Oh. And could be in your heart, could be in your lungs.
And it's a marker of inflammation. And so inflammation can make it go up, and it's a little warning from our body that something's cooking.
Right. And my problem was I kept going from doctor to doctor and could not get an answer. You know, they would just push me on down the road, unfortunately. And actually my daughter in Kansas City heard from her friend that lives here of Dr. Coley's talk and said, Mom, you need to go see her. So my appointment with her, which was with my daughter, both of my daughters, one via phone from Kansas City, and giving her the whole background.
Oh, there they are, look. Oh, there we are. Family, yeah. What a beautiful family.
Oh, thanks. Oh, you got the whole crew. And anyway, laying this out to her is because I'd gone through a whole lot trying to get the hives under control and the Graves, learning with that, and the fatigue from that. You know, it was really devastating for me because I've always been an athlete my whole life. I've exercised, I've taken good care of myself. And I would probably be the least person you would think that's going to have heart disease. Not true. Not true.
So when she came to see me, this was the face of heart disease. A thin woman sitting in front of me, postmenopausal with fatigue, but it set off an alarm bell in my head because fatigue can be a symptom of heart disease in women who are postmenopausal, and it can be as vague as that.
Well,
Wow, that is vague. That's alarming.
And you just don't, it just seems like it could be anybody.
Yeah.
But luckily you went to Dr. Coley, she assessed the situation, thank God for that. So I have to ask you, after the diagnosis, what kind of changes have you made and what did that look like?
Well, since, to kind of move it around the road down to October is when I had an ultra-fast CT scan, and that diagnosed that I had a widowmaker, and it was, I think, about 80% occluded. Is that how you
That's
say
right.
it? Okay. And
What does occluded mean? Sorry, like
occluded
clogged?
means
Like
it's all glue in there.
Oh,
you
wow.
know.
So the plumbing around the heart is a muscle that's beating all the time. It needs blood flow. The plumbing is blocked up 80%.
Yeah.
So blood's not getting to the heart when it needs it.
Oh my God.
Yeah,
And that was that the fatigue we were feeling? Is the blood's not getting
Yes.
to your, okay.
Probably. And now that thought just went right away.
Welcome to my world. That's me.
No worries.
All day.
We want to get this in because we want to know if you have words of advice to women who have concerns that something isn't right,
Yes.
something from your testimony.
Well, I always say to women, listen to your body. We do know what's going on with our bodies. And if you don't get an answer first time, keep going until you do get an answer. I mean, I feel very fortunate to have met this woman because this woman
We all
right
do.
here, she kept me from having a stroke or a heart attack. If she hadn't have done all the tests that she did, and then the ultra-fast CT scan, which was done, I believe, on Friday, and then Monday morning I get a call from the office, Sabra, would you please come in today? We need to talk to you. So I'm like,
Wow.
uh-oh.
Yeah.
Sounds like that's not going to be good news. And so it was a little bit scary for me. It was a little bit scary.
But you
for
know
me.
what? You did the work too by coming to my office, by showing up, and that's what we have to get the message out there.
Yeah.
If something doesn't feel right, you say something.
Exactly.
You have to say something, and we have to be our own health advocate.
Yes.
And we need to, educate ourselves. What does this mean? And what do I do? There's lots on the internet. Some is screwy, as we know.
Right.
But there's a lot of good information
Be
out
your
there.
own advocate.
Yeah,
Sabra.
be your own
That's
advocate.
life-saving advice just there alone. And we
yes.
appreciate you being here and sharing your experience. Thank you so much, Sabra.
You're
Thank
very
you.
welcome.